Thank you for volunteering in the CEREC clinic area. The main purpose for incorporating CEREC crown technology is to place full coverage crowns on select patients that have had endodontic treatment performed on one or more teeth to improve the future stability of the treated tooth. Since most of the patients treated at OKMOM do not go to a dentist for regular treatment, we will be able to help preserve these teeth much longer after successful endodontic therapy. When you arrive at OKMOM, please grab your name tag and t-shirt from the registration desk. From there, you will go to the CEREC area of the clinic. Look for a volunteer wearing a blue t-shirt. Volunteers in blue t-shirts are area leads, and all other volunteers will be in black. The CEREC area lead will lead an orientation with the newly arrived volunteers. There are a few key items you must be aware of when volunteering in the CEREC clinic area. First, only CEREC trained dentists will be allowed to serve in the CEREC clinic area. This is not an area to learn the CEREC process, only for volunteers who are experienced. CEREC protocol is different than other restorative areas of OKMOM. There will be no treatment plan given for porcelain crowns or porcelain onlays from the triage form. The selection of teeth to be crowned will be solely based off the CEREC lead. Currently, the only teeth to be crowned will be all endodontically treated premolars in select anterior teeth where there is considerable breakdown of the tooth. Premolars may or may not have a post placed prior to crowning. The majority of anterior teeth to be crowned will have a post placed during the endodontic treatment. The CEREC lead will be monitoring the endodontic treatment areas to determine which are to have a crown or a post-in crown. If time allows, there may be a few crowns on molars that will have a much greater benefit from crown technology versus just placing a large amalgam restoration. These will probably be on younger adults being treated, but the final decision will be made by the CEREC lead. The CEREC lead will occasionally monitor the restorative treatment area to determine which, if any, is to have a crown. However, endodontically treated premolars and anterior teeth will have the priority. Onlay porcelain crowns and some four-surface porcelain onlays will be placed. We will mainly be using Emax blocks and Empress multi-blocks. 2 CEREC units, 2 milling units, and 2 porcelain ovens will be provided. Some of the clinical supplies to be provided include Prep and Glaze Logic Set burr kits, Astringent X, an Adhes universal bonding agent, and Variolink aesthetic resin cement. The lab supplies will be IPS Object Fix Auxillary firing paste, IPS Emax CAD Crystal Glaze spray, Messinger polishing kit, and Monobond etch and prime. If you cannot live without a certain burr or other supply that is not listed, feel free to bring your own. If you decide to bring your own equipment or supplies, please be sure to label it. Patients are not allowed to walk unattended on the clinic floor. You must use your station cards for moving patients or other issues you are having. The cards are as follows. The green card means bring me a patient. The red card means take the patient to the exit interview. The yellow card means a translator is needed. The white card with the red cross means an EMT is needed. Orange cards means I have equipment concerns. And finally, the blue card means I am leaving for the day or I need a break. Please remember to use your cards if you leave your station to indicate that you will be back in 15 minutes or that you are on a lunch break or have gone for the day. Our goal will be to prep, make, and seat 1 crown per chair per hour and a half. We have 4 chairs assigned to our area. Occasionally, we may also use an additional chair or 2 from the endo section if it is not being used at the time. To enhance your experience and to minimize the risk of cross-contamination, it is recommended that you and your team each bring your own protective eyewear. Gloves and masks will be provided. Our goal is to relieve pain and address the most urgent of needs. The greatest gift we can give our patients is our care. Remember to start what can be completed in the time allotted. Thank you very much for volunteering at the Oklahoma Mission of Mercy. We could not provide free, life-changing dental care to our neighbors in need without you. I look forward to seeing you at Oklahoma.